Healthcare is on the verge of a revolution, especially as digital technology, powerful computing and an attitude change converge together and push everyone involved to rethink their relationship to wellness and health. Highly personalized medicine has been around now for about 10 years, ever since the human genome was first sequenced. This led to a fundamental understanding of the biological causes of over 100 of the most common diseases in the world, including most cancers, diabetes, and heart disease. It means that doctors are now able to combine data from molecular diagnostic tests with a patient's medical history and develop targeted prevention and treatment plans. But better still, it actually allows for the early detection of disease at the molecular level, enhancing the chances of better treatment.
Better still, it gives individuals more understanding and a say on their health status, allowing them to modify their lifestyle to perhaps prevent the disease in the first place. This is the essence of the second game changer, the empowered patient. Historically, the physician was always the best informed about the patient's health condition and potential treatment options. Now, however, with patients becoming more proactive in the management of their health, there is a shift from physician-controlled to patient-empowered medicine. For no longer is the patient willing to be patient.
For acute interventions like cardiac arrests or bone injuries, the traditional diagnose and treat paradigm will continue to prevail. But in the case of chronic illnesses like diabetes or hypertension, and these make up the lion's share of healthcare budgets, the patients are far more likely to ask questions and consider alternative options to take control of their wellness and sickness.
There is no doubt that technology, particularly mobile e-health technology, is pushing the wellness field to the fore. Zora the robot can, for example, with infinite patience, lead physical re-education for people in need in a fun and original way. Able to stand up, bend over, sit down and move by itself, it can be programmed by physiotherapists to help practice individual movements or collective stretching.
It is remarkable how little society invests in sickness prevention, especially as empowered patients are more and more willing to take responsibility for their own health. There is no doubt that the system needs to work out how to become more patient-centric and change the focus from sickness to wellness. As a society, we'll need to make the general practitioner the principal entry point for patients to a network of centralized, specialized curing resources and different decentralized healthcare services treating chronic diseases. Also, the GP should be the reference guardian of the electronic patient record.
This shift from resource efficiency to flow efficiency will go hand in hand with the shift in focus, as we want to aim for maximum value added from the organization and optimized value received for the patient and customer. This brings us neatly to that other thorny issue, namely the cost of healthcare. Since the early 60s, healthcare expenditures have been rising faster than inflation, and they now represent about 10% of GDP across Europe. Did you know that, on average, about 75% of the budget is spent on inpatient and outpatient care, while the remaining 25% goes towards biopharmaceuticals and medical technology? To keep these budgets under control, while assuring high quality of care, both healthcare providers and manufacturers will have to be incentivized to collaborate.
Everyone is thinking about what they need to do. Isn't it time to throw away the old antithesis between health payers and regulators on one side and life science companies and healthcare providers on the other, and look for common ground and common good? The Vlerick Healthcare Management Center works with leading actors in healthcare, including doctors, hospitals, and medical technology companies on finding answers to the big challenges facing the sector.